Hello, everyone, and welcome to another exciting episode of Hanging Out for a Living, where we delve into the transformative power of genuine connections and friendships in the business world. Yes, there is such a thing. Today, we're thrilled to introduce you to our remarkable guest, Katie Borchers. She's the president and founder of Beyond Green Solutions. Katie's unique approach to third-party collections, infused with bedside empathy and cutting-edge technology, really sets her apart in the healthcare industry. Think about it, with over 20 years of experience ranging from clinical practice to technology implementation, Katie is a true trailblazer in improving patient experiences in healthcare revenue cycle management. I dare you to say that 3 times fast. Uh, Join us as we explore Katie's journey and innovative solutions that are really revolutionizing the way we think about collections and customer service. So, Katie, welcome to Hanging Out for a Living.
Wow, thank you. I appreciate that introduction.
Welcome. So happy to have you here. So, to honor and respect your time, we'll dive right into those questions. Sound good?
Sure, let's do it.
Awesome. Your journey from clinical nursing to founding Beyond Green Solutions is nothing short of inspiring. Can you share with us what motivated you to transition into the world of healthcare revenue cycle management and collections?
Oh my gosh, so many things go through your head. When you're a bedside nurse and you move away from the bedside, you have to always be thinking, am I making a difference? That difference that I sought out to do when I became a nurse. And after 18 years at the University of Rochester, I had many of those experiences, right? I was a bedside nurse.
Sure.
Then I was an instructional designer. I did a lot of education and creating curriculum and training. I became an IT project director, so overseeing projects and implementation of technology. So I took all of those experiences, all those building upon one another, and thought, where do I go next? And I saw an experience in healthcare, technology, finance, project management, people management, and really talked to a lot of people that I really valued their opinion and said, what do I do with all of this for my next steps? And they said, you start a collection agency. And really thought, ugh, like, who owns a collection agency? They're terrible people. And really learned I was wrong.
Mhm.
Not only is collections a place where there are a lot of people with integrity and really the customer in mind, but it was also a great place with somebody with my experiences, my knowledge, and my passion. So found out that collections and bedside nursing and technology really did all fit together.
Wow, that is amazing how you're able to pull it all together and be able to really take that next step. So we talk about infusing bedside empathy into third-party collections as being a really unique and compassionate approach. How do you train your team to maintain this level of empathy and communication while achieving high recovery rates for your clients?
Yeah, great question, because that is really the crux of all that we do. Studies show that when you treat people with respect and empathy, you are more likely to establish rapport. When you have rapport, you are more likely to find collaboration, mediation, resolution. And that's really what we sought out to do in the patient collections arena. And so, teaching and training our staff to understand what it's like to infuse empathy leads to those higher recovery results. And it's things like asking open ended questions, truly listening for the answer, and using it as a way to problem solve, assuming goodwill. When you are a nurse and you're at the bedside, people are at a very vulnerable time in their life or their family's life. And taking that mentality to a phone call with somebody who owes money it's a very similar concept, that vulnerability, that difficult situation. And so we train our staff a lot on what I would call the art of kindness and negotiation. Our goal is to resolve the matter for all three parties, our clients, their patients, and our team. And if you keep that patient, you keep that customer, that consumer as part of that win-win-win mentality, that's where we can resolve and make all parties feel that the resolution was suited to them. So we do a lot of training on our team about, how to keep patient in when talking with patients, how to ask open-ended questions, how to give people options, how to pause when there's frustration and let people get that frustration out to really feel heard.
Sure.
All of those are just key ways. Somebody said to me once, how does empathy really equate to an actual recovery rate? And I give a really good example. If we were on the phone with somebody and they said, well, I can't pay this today. I don't get paid until Friday.
Okay.
Oh, okay, great. Well, let's pause and let's wait until Friday, and then we can have that conversation again. And it's extending that level of grace and patience
Sure.
actually leads to them coming back to you because they feel heard, and then we resolve it later in the week. So that's just kind of like a simple example of a conversation we would have.
And I bet that approach really takes that wall down, right? At least to some
Yeah.
level, if not all the way.
People assume what I assumed when I started my agency, that all debt collectors are out to be harassing you and harsh and
Sure.
demanding. And it can't be farther from the truth from the people that I interact with. I find it's very important in any industry that you stay involved in your industry experts and resources. And by diving into the American Collectors Association, the ACA, and the New York State Collectors Association, there are really reputable agencies out there. And I learned a lot from them and then took that one step further by infusing that empathy.
Absolutely. So you have multiple certifications in Epic EMR and are a professional collection specialist. So how do these certifications and your extensive experience with electronic health records really enhance the services you provide at Beyond Green Solutions?
Yeah, that's a great question. So I spend a lot of time talking about empathy, but the other half of our services is infusing that technology. So Epic Electronic Health Record was the EHR that I worked on when I spent about 12 years at the University of Rochester in the technology department. And technology is very important in patient collections. We need to share information transparently. We need to be able to explain the healthcare journey that got them to this bill. We need to give them lots of different payment options and ways to resolve. We have to find different communication methods to establish that connection and begin that journey of resolution. And so that's really where my technology journey began with Epic. But you become very broadly knowledgeable about different technologies. And so when I transitioned out of healthcare and into my company, I wanted to carry on that technology at the forefront of making that connection and sharing that information.
Absolutely. So, balancing your role as the founder of a growing company and your ongoing work as a substitute school nurse and camp nurse is impressive. How do these experiences really influence your leadership and the empathy driven approach at Beyond Green Solutions?
Well, let me tell you, it is a lot of work to get a nursing degree and to pass those state
Sure.
certifications. And as I move further from the bedside, I didn't want to give that up.
Okay.
And when I started my business, it was my first opportunity in about a dozen years where I could go back to the bedside. So owning your own business has some flexibility.
Sure.
And I started picking up a substitute nurse position and then the camp nurse. Now I only do it, I think maybe 5 or 6 days total a year, but it gives me the opportunity for a few different things. One, to give back to the community with the knowledge and training that I have, volunteering as a camp nurse and the kind of healthcare director for the summer camp is some way that I give back. But it also keeps me involved in that experience at the bedside.
Yep.
What, even though they're little kids, I was a pediatric nurse by trade, so pediatrics is really important to me, but the healthcare experience, no matter if it's a band-aid in the nurse's office or a fall on the playground,
Mhm.
it reminds me that we're all patients at some time or another in our life. and we need to show that compassion. And I'm really proud that I still practice after 20 years. I know it's not the same as those amazing trauma nurses that are, really truly saving lives, but in some way, I am still giving back to that degree that I earned over 20 years ago.
Absolutely. And you're still impacting lives in such a positive way. We need all those different disciplines, right? And
Sure.
so important. So, Katie, thank you so much for sharing your incredible journey and insights with us today. It's really clear that your dedication to empathy and innovation is making a significant impact in the healthcare industry. For those of you watching or listening, if you want to continue the conversation with Katie and learn more about Beyond Green Solutions, you can find her contact information in the description of this interview. So, folks, until next time, remember that building genuine relationships and supporting each other's success is the heart of hanging out for a living. Bye for now.